Titus County was one of the first COVID-19 hotspots in Texas. It's feeling the spike in cases like everyone else, but the optimism about promising vaccines comes with a dose of concern, too. And joining us now to explain why is Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant. Good morning.
Good morning. Thanks for the opportunity to talk.
Most of the news about hospitals during the pandemic has come from the big cities. But what's it like in Mount Pleasant trying to deal with the realities of COVID-19?
Sure. Well, in Mount Pleasant, we're Titus Regional Medical Center, and we're a hospital district. We're 60 miles from the border of Arkansas, Louisiana, and Oklahoma, so we're right here on Interstate 30. We support 4 counties other than Titus, so we support about 80,000 people. From a COVID perspective, right now it's tough. And today we have 14 on the floor, 10 on the COVID floor, and 4 in the ICU, 1 on a vent. So these are the same numbers that we were having back in May. From a Mount Pleasant perspective, this is our 3rd surge. We had our first surge in May with one of the meat processing plants, had about 600 positives in the month of May. April and March, we had 22 positives, so it was almost nothing. And then May, we hit the meat processing plant. So had a surge then, got through it. The Tyler hospitals were phenomenal in helping us get through it. Both UT Health and Christus worked with us closely and were able to help us. July was our 2nd surge, and they hit the surge just like us. So we all were facing it. And then now we're going through our 3rd surge, kind of our back to school, post Halloween, pre-Thanksgiving party, whatever you want to say, flu season early surge that we're going across now. And we look at the numbers, what the Dallas area over the last 10 days is up 40% hospitalized. The Tyler area is up 24 to 25%, and we're up about 21 to 22%. So we're seeing that increase right now, and we're starting to feel it. It's pretty tough right now from a COVID perspective.
Well, how close are you to hitting your capacity levels?
Well, with 10 on the floor, it's tough from a nursing standpoint. We have more rooms, but from a nursing staffing standpoint, that's where it gets tough. And all the hospitals in the Northeast Texas region are having that same problem. We do have several strike team nurses from the state of Texas and from FEMA, and we're appreciative of that. It'd be very difficult for us to manage our day-to-day COVID units without those. But we have 8-bed ICU. Can take 4 patients from COVID in the ICU, and we've been full all week. We had a COVID patient waiting in the ER yesterday that needed ICU, and we can't ship them. Tyler's full, Dallas is full. It's very difficult right now. So we had them waiting in the ER for a room in the ICU for several hours.
Well, now we're looking toward a vaccine with these 2 different types of vaccines that so far look promising. But are you nervous about if the Pfizer vaccine comes out first, if you'd be able to handle the transportation, the logistics, and the storage of it?
We're still learning that piece. Am I nervous? Yes. I'm nervous about everything related to COVID. And that doesn't mean we're not doing it. We're participating and we're going all in. But I am nervous on the different logistics that'll be involved. We have submitted within the portals of Texas to become a vaccine center, so our hospital will be able to do it. We have to provide numbers today of what do we think we'll use vaccine-wise, and we have been approved. I am nervous about the first one that has the cold storage requirements, and it's going to be shipped in 1,000 doses, but those can be done pretty quick, and you're going to have a follow-up dose in 28 days again. So trying to get all the logistics and understanding, we're very nervous about it. Now, what they're going to ship it in can handle the cold temperatures. Trying to understand better, are we going to have the freezer, or we'll be able to use some of their storage, or you're just going to have to be able to give the shots in it. We've been told a few minutes ago in a meeting that the storage will last for a few days. So you'll be able to handle it over a few days while you do your shots and your vaccination. So we're still learning a lot. Now, the second vaccine that's coming out that we're hearing about does not have the requirements of the first one from a cold storage standpoint. So it'll be interesting to see. We're working with Texas A&M, their rural hospital healthcare center. Dr. Lynn Dickey chairs that up. We work closely with Texas A&M on rural hospitals. We were on a meeting yesterday with them, and they're working on a process for rural hospitals to participate as well, to make sure the rural hospitals, not only in Texas and Northeast Texas, but across the United States, have access to the vaccine and can get what we need in order to ensure it. Texas A&M will be manufacturing quite a bit of the vaccine. They won a grant about 10 years ago. So they have a manufacturing facility in College Station that'll be participating in the grant. So we're hoping that those relationships will help us as well.
Do you envision a scenario where some of the urban hospitals that might be ready with the storage capabilities get that Pfizer vaccine, and maybe some of the smaller rural hospitals have to wait and get more of the Moderna vaccine?
I'm not sure yet. I haven't seen the plan yet from the state of Texas. There is a committee or council working on it. The Texas Hospital Association had an update for East Texas at 11 o'clock, and they gave us the most recent information that they have. There's still a lot of unknowns. So we're hoping over the next 48 to 72 hours, there is discussions that it'll be available next week. And there's the possibility that it could go to the FDA next week and by the 1st of December even. Now, everybody's targeting mid-December, and that's what we're being told. But there is some signs that it could be happening earlier. Now, I'll say this. Through this whole process, and in Tyler and Mother Francis and UT Health, the hospitals in the larger cities have been just great with the rural hospitals. I cannot complain. We're competitors, but at the end of the day, all the healthcare systems in Northeast Texas have worked together to fight this crisis and to fight this pandemic. So if it comes to it, we don't have the storage. I have no doubt that our friends at UT Health in Tyler and our friends at Christus in Tyler and Texarkana are going to step up and help us as well. So I just cannot say enough how much the health systems have worked together to fight this crisis. It's not an us versus them. It's a we working together. So I've just been impressed. So I want to give a shout out to all your health systems in the Tyler area because they are partners in this, even though we're competitors.
What would you say is your biggest concern right now related to COVID-19?
Well, my biggest concern is just going to be about the strain on the healthcare community. You asked earlier about resources. We are strained, and we're pushing that limit of the number of people we can hold in the hospital, definitely hold in the ICU, but eventually in the ER. And with the increases in the urban cities, what's going to happen when we continue to reach that point? And that's my biggest concern. So we're talking to our community. One of our doctors, our primary care docs, Dr. Craig DeLisi, did a PSA for us a few minutes ago, talking to our community about the 3 things that we all have to do: social distance, wash our hands, and wear a mask. And COVID's real, and it's deadly. And we just need to make sure that people in Northeast Texas realize that, and we all work together to solve this. It's not just going to be the hospitals and the doctors. It needs to be an effort of everybody in Northeast Texas working together to mitigate the spread.
Terry, I know you're busy. Thank you for your time today.
Thank you.